Nikhil. Thank you so much for that introduction. My apologies. There's a problem with my Kaspersky, so my webcam isn't working. You can see my full screen, right?
Yes, ma'am.
All right, sure. So my presentation is actually going to be really brief. So this is something which was presented as an e-poster at the ELCC in March. So this was done by an Indonesian set of researchers, and this looked at, this was basically a systematic review looking at the benefit of atezolizumab in the first line for patients with advanced non-small cell lung cancer, especially focusing on overall survival. So when we look at the background and rationale, so this is essentially what they wanted to evaluate. So they wanted to evaluate the efficacy of atezo, both as single agent as well as in combination with chemotherapy when you compare it to chemotherapy as the first line therapy for non-small cell lung cancer. So like any systematic review, this is their methodology. So they looked at data from 2015 onwards, and they looked at, so they included studies which were published after 2015. So the procedure, they started it in January 2020. So they searched, the traditional databases, and so they found essentially, sorry, one second. Yeah. So they found 11 trials. So among these 11 trials, what you can see is that what I'm going to highlight with the arrows are the 6 trials which looked at single agent atezolizumab in combination with chemotherapy, and the remaining 5 trials actually looked at atezo in combination with either chemo with or without bev in comparison with chemo plus or minus bevacizumab. Now, any systematic review, when a review is done, you need to ensure quality of the trial. So in this, they use the Newcastle-Ottawa scale, and all 11 studies were actually assessed using the scale, and all were termed as good quality as per the scale. So the in terms of how good or how robust the studies were, they were all good quality. Now, when we move on to the results, so this is essentially the top part of this this plot is showing the benefit, the comparison of single agent atezo versus chemotherapy. Now, the second part actually shows atezo plus chemo versus chemotherapy alone. So, if you can actually look at the weightage, I'm not sure if you can see my pointer, but if you can actually see the weightage, the atezo chemo combinations actually had a higher weightage, so accounting for 63.5%. And this was around 36.5%. So, and if you look at the hazard ratios for each of these, so when you look at atezo single agent versus chemo, this was around 0.66, and with a confidence interval of 0.54 to 0.81. And when you look at the lower part, which is your atezo chemo combination versus chemo alone, the hazard ratio was 0.75, ranging with a confidence interval of 0.65 to 0.86. Now, how do you grade your evidence in a systematic review? So there is this is the grading of recommendations, assessment, and development and evaluation. So the results were moderate. So in terms of significance, so the authors believe that the true effect is probably close to the estimated effect. So it was not high, but it was moderate. So to summarize the results, this was a systematic review of 11 clinical trials, 8,000 odd patients, and with the studies were all of good quality, and the grade of evidence was moderate. And so when you looked at the analysis, there were 6 studies of atezo versus chemo, which showed that there was a trend towards a prolonged overall survival with the hazard ratio of 0.66. And there were 5 studies which looked at chemo plus atezo versus chemo or chemo plus bev. The hazard ratio here was 0.75. Now, this is my last slide. And so this is Monday morning, and take home messages. There seem to be a trend towards an improved overall survival, either if you use single agent atezo or in terms of chemo plus atezo plus or minus bevacizumab. So that's the end. I'll stop here. Sure.